Hello everyone. Thank you for joining us again today. If you don't know, my name is Matt Hawthorne. I am a graduate Ignite Innovation Fellow here at Clarkson. Thank you for joining us again and welcome to our Fall 2020 Ignite Speaker Series. This talk today kicks off our second mini-series on UN Sustainable Development Goal number 3, Good Health and Well-Being. For this talk, we're going to talk with Dr. Ashley Graveline, OTD, a clinical assistant professor of occupational therapy at Clarkson University. As an occupational therapist, Dr. Graveline has over 14 years of experience treating patients in multiple clinical settings and 10 years of experience concentrated in inpatient mental health. Her research has focused on the use of experiential learning in mental health settings to improve student confidence and clinical reasoning skills, the efficacy of comfort rooms to reduce restraint and seclusion on patients, and the impact of weighted modalities to improve comfort measures with adolescent patients. She remains a passionate advocate for promoting preventative mental health services within the community setting. With that, I'm going to pass it over to Ashley to begin. Thank you.
So I guess I'll start off by explaining a little bit about what occupational therapy is. So for occupational therapy, we are looking at helping people across the lifespan doing things that helps them improve their daily activities or their daily occupations. And by occupations, I'm not necessarily referring to jobs, although that's part of your occupations. What we're referring to is anything that you have to do on a daily basis. So get yourself up and dressed in the shower, cook your meals, cleaning, going to school for children would be their occupations. So we want to help people live their life to the fullest and then make them more productive every day. Occupational therapists tend to focus on more of a holistic approach, so we look at adapting the environment and the tasks so that they better fit the person's life. So mental health, when we talk about mental health, it refers to the ability to successfully perform mental functions that results in productive activities and fulfilling relationships. So a mental illness doesn't necessarily turn into a disability until it affects their ability to function and then their ability to be productive in everyday life. So when we talk about engagement in occupations and mental health, we think about it as objective, which is like your physical and observable, and then subjective, which is your emotional and then your psychological aspects of like a client's everyday experiences. Our occupational therapy program here at Clarkson, the students that graduate will have the training and education to help their patients develop and maintain positive mental health, prevent any mental health decline, and then recover from mental health challenges. They go through in their curriculum in grad school in the 2.5 years, they take a few different mental health courses. The very first one that they take is kind of an introduction to mental health, and in that course, we cover the DSM essentially from cover to cover. So the DSM is the Diagnostic and Statistical Manual of Mental Disorders, and they learn, like I said, just about every single diagnosis, what the classification is, what the functional implications are, the prevalence, the gender ratios, and then eventually later on in some of their other classes, they learn how to treat those functional implications in their practice setting, wherever they may be. And as an occupational therapist, we address a client's mental health or their psychosocial considerations, no matter what the practice setting is. So a lot of times people think of occupational therapy as more of like the phys dis setting, so like working in an acute care setting, an outpatient, like a hospital-based setting. And that's true, that's exactly where we are, but we're also in some inpatient mental health settings, some outpatient mental health settings. And when we're in some of those traditional phys dis settings, we still treat the psychosocial considerations. So for instance, like if a client comes in and you're treating them after like a motor vehicle accident or they've had a CVA, a stroke. And some of those physical impairments that you're treating, you also need to address the psychosocial component. So the patient that you're treating that just had the CVA may develop some depression because they're having a hard time coping with some of the life changes. Maybe their loved one who's taking care of them is having a hard time adapting to the role of a caregiver role now. So if we don't address these mental health, the psychosocial components into our treatment sessions, then we're not necessarily addressing the whole person. And the psychosocial considerations could eventually impact their recovery and the physical dysfunctions. So when we talk about mental illness, it's just about anything that affects your mood, thinking, or behavior. So if you think about that, if something was to impair your mood, your thinking, or your behavior, it's likely, depending on what the degree is, could impair your ability to function in every day. And why we have why our field is getting back to its roots with more mental health is because of the increased number of people who suffer from a mental illness. So right now, 1 in 5 live with a mental illness. That's 46.6 million Americans. So that's roughly 19% of the population have a mental illness. So that number is significantly higher than some people believe. 2018, more than 48,000 Americans died by suicide. It is still the 10th leading cause of death. And 10% of high school students have attempted suicide at some point in their high school course. So with those huge numbers comes that public stigma of mental illness and how that interferes with somebody's ability to seek treatment and to get the proper treatment. So you have, overall, we have public perception of mental illness, and that would be like what everybody else, we talk about that as like the public stigma. So it would be like the negative stereotypes of individuals with a specific condition by others in society. So like what the public thinks about somebody that has a mental illness. And then we talk about self-stigma, which is the individual then begins to agree with and internalize these thoughts. So the negative stereotype that the public puts on somebody with a mental illness, they then begin to internalize, which then impacts their ability to seek treatment. And the stigmatizing responses in the labeling of the individual really interferes with all of those courses of treatment. And almost always this stems from a lack of understanding. That's where the stigmatizing response comes from. And the harmful effects, I mean, there's delayed or like reluctance to seek treatment because they don't want to carry that label. There's lack of understanding by family, friends, coworkers, poor self-esteem, behavioral withdrawal. There's significantly fewer opportunities for work and school. You have bullying, physical violence, harassment, and then there is a lot of differences in health insurance and what they cover for mental illness treatment. We also have to think of the stigma that employers have on others with mental illness is also high. I think eventually what we hope to see is more of a linear response to mental illness. So you have your physical dysfunctions and then your mental illnesses are kind of simultaneously on the same level. So the way I think of it too is if you go to an employer, and this is what research indicates too, is that employer response. So people tend to not talk to their employers about their mental illness for fear that they're going to stigmatize them or they'll have that negative stereotype towards them. So if you think about going to your employer and maybe you reach out to your employer because your mother or your sibling or your son or somebody has been diagnosed with cancer. It's an awful diagnosis, and you let your employer know that you're going to need some accommodations. You need some time off, you need some extra times to complete your work duties, and most of the time your employer is going to respond with, "Oh my gosh, I'm so sorry, what can I do to help you? Absolutely, is there anything that we can all do?" And then if you go to that employer with, let's say, the same situation, but you let them know that your daughter or your loved one or your spouse has been diagnosed with bipolar disorder or major depressive or schizophrenia, are you going to have that same response from your employer? Or is the response going to be different because it's a mental illness versus your physical illness? So eventually our hope is that everybody looks at everything equally and it's the same response. We're not quite there yet, but I think that the public perception is improving on mental illness just because of the education and the awareness. So what can be done? We need to use person-first language. So a person with schizophrenia, I know have you ever heard anybody call somebody a major depressive person. Like, we have to make sure that we use the person first language, and educate, speak out against, stigma. If you hear somebody talking negatively or that has that negative response, just providing education can be enough sometimes. For our program for the medical field, we found that the research really points to contact-based, hands-on exposure. So even for students who are going into the medical field, there is still some stereotyping for mental illness, and what they found with research is that by exposing them to this population is what gets rid of some of those stigmatizing responses. Social advocacy, don't let the stigma create self-doubt, don't isolate yourself. There's a ton of support groups for mental illness. And then now we have our pandemic and our crisis right now, and what that's doing to all of our mental illness, regardless of whether or not you have a pre-existing mental health condition or not. So in general, a pandemic causes fear and worry. People are worried about losing their jobs, getting laid off, decreasing their hours, financial support. They have difficulty sleeping and concentration. You have chronic health problems or worsening mental health problems because maybe the effects of the social isolation of the pandemic are interfering with your mental health, or maybe you're not able to seek the help that you need because you're not able to go to your appointments. A lot of all of this going to an online platform. There was a lot of patients that couldn't get to their appointments because they didn't have access to that type of services. And then there's been a large increase in alcohol and substance abuse during this time. So people who may respond strongly to the restrictions of the pandemic are, of course, like children and teens who really need that social connection. People who are caring for loved ones may feel more isolated or more restricted in that caregiving role. The frontline workers, essential workers, people who have an existing mental health condition or an existing substance abuse, somebody who's lost their job, or people who are already socially isolated or homeless. Interesting, in January 2019, so before the pandemic even started, 1 in 10 US adults reported symptoms of anxiety or depression. Maybe not necessarily diagnosed, but complained of the symptoms. And now during the pandemic, so just since all of this has begun, it's now 1 in 3 are complaining of anxiety and depression. So that number has risen significantly. And then out of the 1 in 3 that have complained, 13% of them have developed a new or increase in substance abuse disorder, specifically pointing to that's their way of managing stress during the pandemic. And then also 47% of those who were sheltering in place during all of this pandemic reported negative mental health effects that were correlated directly with stress related to the coronavirus. So there is significant implications to mental health. So really, what can we do during this pandemic? Take care of your emotional health. Make sure that you're not discrediting some of your feelings. Take breaks from watching TV, reading, listening to the news. Social media sometimes, especially now, tends to be extremely negative. And one of our responses is that online platform, because we can't socialize, we're spending more times on our phones and on our computers, but sometimes that's a good time to take a break from all that negativity. Take care of your body, deep breathe, stretch, exercise, eat well, all the good things. And then make sure you take time to unwind, connect with others, join organizations, support groups. If you need that social connection, then doing it through like friends and family versus like the social media platforms. And then speaking specifically of like college students and how they're reacting to this pandemic, the National Science Foundation, which the study just came out in the last couple weeks. So it was done by Means in Nisler, and they surveyed 1,000 undergraduate students between May and June of 2020. So specifically when all this pandemic was going on, and what they wanted to look at was student satisfaction when undergraduate programs transitioned from an in-person to an all-online platform. And what they found was student satisfaction significantly dropped. The students reported, like some of the issues they reported was difficulty staying motivated and focused while they were at home. They talked about not having a quiet place to go to at home in order to not just be able to study, but join some of those online Zoom classes. They missed collaborating with fellow students, and they also discussed difficulties with internet and computer devices that cause significant distress. So what the study looked at is what the students' opinions were of their courses and their overall college satisfaction prior to the pandemic, and then while all online learning platform was going on. 81% of students said that they were either very satisfied or satisfied with their courses prior to the pandemic. After moving fully online, 19% said that they were very satisfied, which was a drop from 51% prior to the online platform. And then the areas concerned, again, that were specifically identified were opportunities to collaborate with other students was the highest rated, keeping students interested in course content, and then making students feel included as a member of the class. On the positive side of that, the students, the majority of students reported that the course content itself was the same, if not better, prior to going online. They reported having a better understanding of what their expectations were for the courses. And then what I found really interesting was they thought the instructor's knowledge improved and the instructor's availability for the course improved. So I'm thinking that everybody made sure that they did the best that they could to make themselves available to help students, because we've transitioned from this in person to an online platform. Students also reported that there was 28% of students in this whole survey that were very satisfied versus 8 who weren't, because their instructors put personal comments on their assignments, and they specifically commented about how it made them feel a part of the class, and it made them feel like their instructor knew them versus them just being another number in a big lecture hall. So that was quite interesting. So what can you do if you need help during this time? We have our student health and counseling services is amazing, and when you reach out to them, they can help you out in any way. There's Reach Out, which is a crisis hotline for St. Lawrence County. You have a crisis text line. There's a national suicide prevention lifeline. And our Clarkston Library, specifically Mary Cabral, who is the health sciences librarian, she developed this incredible resource, and it's for students and it's for faculty. It's like a little tab in the science, and it's mental health. It's a mental health resource guide, and it provides information on just general mental health. It talks about stigmatizing impact. It gives additional resources and links. So you can just click on the links and it takes you to all the resources that you need. It's a pretty great service. Our students have all kind of looked at it and explored it, not just from like how they can use it to help their clients, but also if they ever needed any of those services, then they know where to reach out for help. That's all I got. Any questions?
Awesome.
Sorry, I talk really fast.
No, that was perfect. Thank you very much. So we do have one question specifically. Marty Whalen asked if you could please repeat the name of the study and the author group and publisher.
Sure can. It was National Science Foundation,
okay,
and the author is Means and Neisler. It was 2020 that it just came out. It was I believe it was the Langer Research Association, but.
Perfect. If we may be able to get the link, and then
Yep,
we'll send it in the follow-up email.
Yes, I have it right here.
Awesome. Perfect.
Yep.
Looks like we got one more. I do have prepared questions as well, so that helps. Oh, Mary Cabral put in the mental health resource guide. Perfect. Thank you very much for doing that. So one question that has, maybe I'm being a little selfish, it's personally interesting to me, the increase in the spike in anxiety and depression because of the pandemic. Are there any common treatment practices in OT that could be used by individuals? I know you mentioned just trying to stay healthy and eating well, exercising, that sort of thing. Are there any practices that you use in an OT setting that people may be able to practice at home that could help with?
We do. I know people sometimes have some mixed reviews, but it's helpful to do mindfulness, stress management techniques, especially during all of what's going on now. Also getting out. I know a lot of people, I think in what a lot of the research has shown too is during this like shelter in place, what people thought was like, I'm gonna shelter in place, I need to stay at home, I shouldn't go anywhere at all, where that wasn't the case. Still getting outside and taking walks and going to, you know, like, I don't wanna say a dog park, but like hiking, just things that can keep you still socially distanced. And a lot of people quit doing like all of their leisure activities because of that. So those would be my suggestions, would be for you to explore your leisure activities and figure out what you can do while still maintaining those social distancings. Plus there is a lot of stress management techniques that you can do, and even like simple like, you know, like making a list of pros and cons. I know but we did stress management groups. One of the faculty in OT did stress management as her capstone project last year, and the students loved the stress management group that they had gone to, and she had given a ton of like cognitive behavioral cognitive behavioral strategies and all of those tools. So
do you have any suggestions, you know, as we move into the winter months, especially up here in the North Country? You know, there's no hockey, there's not a lot going on up here at the moment, or there won't be in a few months is the projection. Do you have any suggestions, you know, when maybe running outside and doing those sorts of things aren't always feasible?
Oh, I wish I had a list of like what you could do in the winter months that like would take away from some of this social distancing. But I would still say getting outside. I know that that's not always possible, but and still like if exercise is what you need to do, then what you can do inside to, there's been a lot of exercise platforms that have gone online, and you can do them live and with, and like faculty joined a couple of them that like you were with people in, you know, Texas and like in other states, but you're still exercising with them. I would say anything like that. I do like the Thanksgiving is hard too, like the holidays, now that they're coming out with some of these restrictions on, you know, people shouldn't travel when they have family. I would like even do a Zoom meal. I know that's not the same thing, but you're still connecting with your family and you're still there. So
yeah, so a good another question about that. Oh, wait, I'm gonna pause. We got one here. Can you talk about the use of OT for mental health in older adults? So I'm assuming, Karen, do you think you could clarify, do you mean retired individuals or simply just adults both in career and retired? Let's see here.
Well,
Is there a
even if
difference,
she
I
doesn't,
suppose?
we'll see. One of the things I didn't mention with when I talked about the suicides, the 10th leading cause of death, it's not really necessarily the elderly population, but I think sometimes when we think about the risks of depression, we think about some of those teens and adolescents, and that's not where the statistics lie.
Okay.
It's actually like 52 to 60, I think it's 52 to 60 is what the statistics rate is for men, is where that major depression and that suicide risk falls. So that is all, and a lot of those components are changes in physical health, not knowing how to cope with it. And for the elderly population, when they transition from, like, let's say living at home independently to assisted living and then eventually to a nursing home, or they've lost a lot of that autonomy, like their independence, they can't take care of themselves the way that they could before, and making sure that we as OTs are addressing that, even in an outpatient setting. If you have a patient that comes in and they're there because they fell and broke their hand and they're using a rolling walker and they live with somebody, maybe asking them like, what did they do for leisure activities at home prior, and getting them engaged more in some of those leisure activities and asking questions about like, what's their quality of life, asking depression inventories. We can do that in an outpatient basis. They get forgotten a lot, but we can certainly do it. And then addressing those considerations in nursing home settings as well. Not just like your skilled nursing facilities when you have patients coming in for rehab. They've had a significant physical change, which is then gonna result in like a significant impairment in their activities of daily living, or maybe they're not gonna be able to, they might have to go home with a child, or they might need a ramp, or they might need an assistive device. So making sure that we're addressing how they're gonna transition to those roles even when we're doing the physical dysfunctions. Because if you're not addressing those, then you're going to have an elderly lady that's physically well, but her mental health has declined and she's still not doing any leisure activities because she's depressed. So it's still not going to. I'm not sure if that answered her question or not.
Yeah, she said specifically talking about adults over 55 with mental illness. Like, are there any specific uses for OT? Yeah.
I wish there was more services than there is. The services are really lacking in the outpatient setting for adults over 55 that already have a mental illness because there isn't those supports set up in the community. But I would say the same thing for a lot of those stigmatizing responses are with the community dwelling older adults because I say we, but like society sees them more than the ones who are inpatient or the ones who are in the nursing homes because we see them walking in public. So that's where those public perceptions come from. But I wish in the local area I could list services but there is not a whole, we have a step-by-step, which is I'm not sure if people are familiar with it. It's run by St. Lawrence Psychiatric Center, but it's an outpatient peer support group. And it's kind of like they can come and go as they please. They have leisure activities. And so that's a good support service for them. Same thing they have some respite for older adults. But
have you seen any major changes in potentially the assisted living areas or nursing homes when it comes to the reduction in leisure activities that might have occurred through the pandemic? Has that been a real impact on them from a mental health standpoint?
Yep, and what we've heard from a lot of the elderly is the miss in visitations, that lack of connection with their family members. And some of them would, although obviously we're not the ones that place the restrictions, but some of them would rather take the risk and meet with their family members than spend those few weeks of illness or sickness by themselves and meeting with somebody over the computer. So a lot of that, and a lot of restrictions in terms of just the mental health population too, of not being able to go out into the community because those restrictions on. And same thing with the nursing home, there's the lack of staff to complete the leisure activities, and they normally go out and do gardening and all that kind of stuff. So there's definitely been some implications.
So you talked about kind of like a Zoom meal for Thanksgiving. Do you see any technology that's kind of come about that could help facilitate more of those types of social interactions that aren't necessarily social media or anything like that? For example, my family recently got one of the Facebook portals, which kind of is like Zoom for Facebook, but the camera is interactive. It zooms in and it moves around to kind of follow you. Are you guys tracking that in any way, shape, or form as ways to help mitigate some of these things?
I'm not sure if there's any research being done on it right now to know if there's any if any of these devices are more supportive than others. We've had a few patients using the Alexa, the new Alexa. That's the large screen one that interacts. So if you have the Alexa, then you can call them and it gives a panoramic of your house. We've had a few patients that use that now. I've had a few patients that use that as a check-in, for their parent. And some of them, you can give them access to the Alexa. So, you can call the Alexa and I say probably a little bit of a breach of privacy, but you can call the Alexa and almost log into their Alexa without them answering it so that they can see what their loved one's doing. So, maybe their mother, checking in on their mother to see if she's home or anything like that. But there's also a ton of support groups that are online now that you don't even have to physically go to, but you still interact. Some of them you don't have to put your camera on. You can ask questions. And then some of them you can put your camera on and just engage in the support groups. But a lot of them offer a free click on the link, join into the support group. So
awesome. Cindy McLean had another question about the impact of changing mental health visits via telehealth versus the human connection. Has that been studied at all? Do you know has it been more effective, less effective?
It's starting to get they're starting to get a lot of research on that.
Okay.
And right now what they're finding is that a lot of patients are not showing up for their telehealth appointments, and they're not they're not forming the connection with their therapist. So they're not communicating all of their needs. They're not really relaying that information. And plus the therapists are reporting that that lack of connection doesn't get them the opportunity to read their body language and connect with them. And for mental health, that's a huge thing. When you have somebody sitting in front of you and you're familiar with them and you're comfortable with them, you know if they come in the next day and they're different and something's off. And they may miss that because they're doing that telehealth. Also, outpatient services in this area are pretty down significantly, and I'm not sure if that's specifically related to the pandemic and people not reaching out for services, or if it's that our providers, because some of the providers still aren't seeing, I think a lot of them are up to max now, but for a while they weren't, so I'm not sure if that's just catching up. But
And so, you know, when the average person thinks about occupational therapy, you know, you said this a little bit at the beginning, mental health isn't necessarily always thought of as part of the practice. Is it, you said earlier in an earlier conversation that it seems to be growing. At what rate? Like, are we at a shortage right now? Do we need to, you know, kind of where do we need to be in order to help people effectively?
Absolutely. So OT evolved in mental health. That's how we came about. So we first came about when all this, when they would call your psychiatric centers, your insane asylums, that's where we came out, and they just happened to figure out that providing patients with things to do during the day, the only reason they did it was because they provided the staff, it kind of gave the staff a break, but what they found is that when they provided them with occupations or leisure activities and things to do, that the patients were more satisfied and the staff were able to get more things done. So that's kind of where we evolved, and then we kind of took a turn more towards the phys diz, but there is a huge mental health shortage right now in OT. Average, like, over 60% are in your like acute care settings, school settings, hospital-based settings. I believe as of 2019, it was roughly like 4% of practicing OTs are in mental health setting. So it's significantly lower. Any OT, well, I guess depending on how long you've been in practice, you may need to definitely take some continuing education courses on mental health, but most OTs are capable of providing mental health services. It's just a matter of which area they choose to serve in. There is now, because mental health has been identified as a shortage, there's now a loan repayment program. In 2017, 18, and 19, it was identified as a shortage. So if you are an OT and you work in a mental health setting, through this loan repayment program, because mental health is identified as a workforce shortage, they will pay back a percentage of your loans. So that's kind of a way to entice OTs. Also hoping that because we have a large mental health population in St. Lawrence County and we have the inpatient center and outpatient, that with Clarkson having an OT program now, that the students get to explore those settings, that maybe it will entice them enough to stay around and kind of dabble into the mental health a little bit more than most therapists do. But
So is the demand mostly in outpatient type of settings or in those inpatient hospital type of settings?
both, but
Okay.
inpatient is, I would say inpatient more than outpatient.
Okay.
When you go down towards more like Syracuse and Plattsburgh and you get, well, I know they're two different locations, but I'm looking at like the inpatient centers. Like they have so many more OTs than we have that are practicing in mental health. So
Awesome. Are there any other questions from the audience? I think I have one more prepared question. So the last question that I could have is, you know, we discussed the pandemic a little bit. We discussed those sorts of things. For students, you know, there seems to be this, you know, have we seen a change back to normal from students now that we're more in person? Is there a larger disconnect for students who have stayed home this semester versus those who are here? Is that being looked at the moment?
it is in that the research article that you can share when you send out the email, they're starting to look at now when they're moving towards hybrid, and now students are starting to get back on campus if that satisfaction rate is increasing. I think we're noticing it. I can only speak for our program. I think we're noticing that the students are definitely happier now that they're getting some of that hands-on experience. And even as a faculty member, it's much more difficult to teach in an online, especially with some of our graduate programs that are hands-on components of the courses. To teach that online is more difficult. But I think we've all adjusted really well, and I think the students have adjusted well. They may not be as satisfied as they were before, but I think you're going to see that start to improve once we start to get here a little bit more and more of that hands-on component.
Yeah. Awesome. Well, I think that's, one more question. Mary McCarty asks, could you elaborate a little bit more on the negative stereotypes and how they affect people with mental illnesses?
Yeah, like the negative stereotypes is that public perception of what somebody with a mental illness, and it could be as simple as like I don't know it off the top of my head, I should send it to you and you can send it, but there's a YouTube video, they did this research in New York City and they had a patient that had schizophrenia and he had a lot of paranoid delusions, and he was standing on the street corner in New York City and they were videotaping him, and he was a part of it. He knew that they were partaking, and they watched you could see the amount of people in New York City that kind of came around him and nobody would go near him and nobody would stand near him on the crosswalk, and they talked about that negative stereotype because people were, and then they interviewed some of the people afterwards to find out like why they purposely kind of went around this man, and they said, well, he's super unpredictable and like he was talking to himself, and when the man really had no violent tendencies, but he did have those paranoid ideations and he was talking to himself. And so it was pretty interesting to see, just people didn't even realize that they were doing it. And I think that's a lot of it, is that public perception that we have, and sometimes we don't even know that we're doing it. Like, you know, I hear people say sometimes just about like their friends, like she's crazy, that's insane, like, you know, they're weird, that kind of thing. Like those are the types of comments sometimes that, like, if you were to say something about like maybe somebody has an autism spectrum disorder and you don't know it, and they have some like odd tendencies because that's part of their classification, and then for somebody to say, well, you know, I don't really sit over there because that guy's a little weird. So it's those perceptions that kind of bring that negative stereotype, and then eventually if that gentleman or that student or whatever hears that, then he may be less likely to tell somebody that he has this diagnosis, because then they're going to stereotype that response. So I'm not sure if that really answered her.
Yeah, I think just to follow up a little bit, so it asks how they affect people with mental illnesses. So basically, have there been any studies done that, where basically, like, if someone, even if they're diagnosed with a mental illness, does the stereotype or the stigma visibly from people, does it tend to make that worse, or that sort of behavior?
Yes, yes, it tends to make the person with the mental illness, the stereotype from other people, tends to make the symptoms exacerbated, and it also tends to make them not seek out help. And that's not just like, when I say not seek out help, like that's not like I'm a newly diagnosed with major depression and I'm not going to go to my doctor because I don't want to get diagnosed. It's people who already carry the diagnosis and maybe they don't even want to go into the clinic because the clinic is on Main Street and I'm going to have to walk into this outpatient mental health clinic, and then everybody's going to know. And the same thing with, they show that there's less job satisfaction and more likely to have employer issues because they don't share those because of the negative stereotypes. So yes, it definitely affects those with the mental illness.
Gotcha. So another question that we have is, are there interventions that may be that benefit physical health that are also remarkably effective in improving mental health, marathon training or other types of exercises?
Just about exercise is like one of the highest rated, what am I trying to say? It's the best thing to do for your mental health. So, you know, exercising releases endorphins and it just makes us feel better. So any type of exercise that somebody can partake in, even if it's just like a brisk walk, not necessarily a marathon running, is good for your mental health, for sure. And then right now, anything that you can join that's keeps you socially isolated but still allows you to socialize is a good thing too.
Awesome. All right, any other questions? Give it another second. Awesome. Well, if there are no more questions, I want to thank you again for joining us, everyone. I want to thank Dr. Ashley Greveline for joining us as well. Thank you very much.
Thanks for having me.
And you know, if anyone has any other questions, you can always email us at ignite@clarkson.edu. We're happy to field your questions then. And look out for a follow-up email with the recording and with some of these links that we've talked about today. Thank you very much. Have a good one, everyone.